Hello, thank you for joining the latest one-on-one episode, a video series from Modern Healthcare Custom Media featuring insights from leaders across the industry. I'm Maria Castellucci, a custom content strategist here at Modern Healthcare. On today's episode, we're speaking with Ruth Scott. Ruth has over 40 years of experience in acute care, home health, and population health management. She spent her first 25 years in the acute care setting in various roles, from a staff nurse on general med-surg units to director of patient care services, oncology, transplant, and behavioral health. She went on to become a director of clinical services in home health and hospice, where she developed programs that incorporate a patient's goals into their individualized care plan. Ruth has been with Integra Community Care Network since its inception in 2015 as the Senior Director of Population Health Management. Integra Community Care Network is located in Providence, Rhode Island. They have over 150,000 covered lives with contracts with public and private insurers. Integra Community Care Network is comprised of Care New England Health System, Rhode Island Primary Care Physicians Corporation, and South County Health. Finally, before we dive in, we'd like to thank the sponsor of this episode, Bioformus. Bioformus is a global leader in providing advanced technology and clinical support for care at home programs and digital therapies. Bioformus' clinically validated platform, powered by machine learning and advanced analytics, enables improved clinical outcomes, maximizes the effectiveness of high-value drugs, and lowers costs across the entire care continuum. Bioformus is transforming patient health through personalized, predictive care. Ruth, thank you so much for being here today. I'm really excited for our discussion.
Thank you. It's a pleasure being here, and I really look forward to really discussing Integra's journey into remote patient monitoring and, where we are now, where we've come from and where we are now and where we're looking to go.
Yeah, I'm really looking forward to hearing more. So let's start with when Integra was considering a remote patient monitoring program. What challenges was your team looking to solve?
Oh, that's a great question. We were really looking to overcome obstacles in disease self-management. So what we were really trying to do or find a partner with was to be able to enhance our patient education with our CHF and COPD patients. But we knew that we wanted to move beyond just those two diagnoses and move into other chronic diseases in the future. But we needed to leverage technology to be able to track and trend the biometrics, because we wanted to be proactive in the identification and treatment of subtle changes that we knew were really occurring with our patients, but we just had no way of capturing them. But we also were aware that there was a means of early identification of a patient's biometrics, their vital signs, their pulse ox, etc., that would allow us to have proactive treatment and be able to prevent the patient from an exacerbation of their CHF or COPD. And we wanted to be able to bring this, technology and this proactive treatment and be able to educate our patients and let them know that this is the subtle change that you're having and this is the effect that it's having on your health. But we knew we'd only be able to do this through remote patient monitoring. And, a great example of this is we were, looking, a great example of what we're really looking for the RPM technology to do was with our patient, Mrs. McD. She's a 78-year-old female. We met her in our community hospital. She has COPD and CHF, but most importantly, she had obstructive sleep apnea. Her pulmonologist had ordered CPAP for her at bedtime. And when we met with her, we offered her the ability to enroll in our remote patient monitoring program. She willingly accepted because she didn't like the way she was feeling. And we also explained to her that it's going to be monitoring her pulse ox and going to be looking at her, vital signs. And we'd be asking a daily questionnaire of her. And she was all for it. She would do anything to be able to feel better. So she was discharged home. We set her up in the equipment, and she would answer our questions every day. One day she'd feel great, next day she wouldn't. So with this, we really looked at our dashboard, and we really looked to see what was the difference between June 4th and June 5th. And we were able to see that all of her biometrics, her pulse ox, her heart rate, etc., were great on June 4th, and she reported she felt wonderful. but on June 5th, they were all down, and she reported she didn't feel well. So with that, we were able to really trend it and be able to correlate her good and bad days to her self-reported wellness assessment. And we were able to go back to Mrs. McD and say, did you wear your BiPAP, CPAP on the 4th? And she's like, yes, I did, but I slept in my chair on this day, so I didn't put it in the next day. So we were able to show her that if she was able to wear her CPAP, she felt so much better, and all of her vital signs were great. So we also reached out to her pulmonologist, and were able to show him our data and the trends. And he had been making adjustments to her medications just in response to her calling him saying, I just don't feel good, I've got general malaise, etc. And now with the use of our data, he's been able to actively and treat her and resolve most of her medical complaints just by her wearing her CPAP and just being compliant with it. It's just been an absolute wonderful thing to see how this monitoring tool has provided this woman with such a great change in her activities.
Yeah, Ruth, that was a really great story to really illustrate what the impacts can be for real patients. So many organizations are pretty early in their journey, considering a virtual care program like hospital at home or even remote patient monitoring. So with Integra having deployed their RPM program about 6 months ago, what are some of the initial learnings that you could impart on our audience?
Oh, there's a lot of them, but one of the key ones is really educating all your stakeholders. And what I mean by that is anytime discuss use case scenarios and the benefits of the remote patient monitoring with anyone and everyone that will listen to you. And you can be, I have my transition team at the hospital, and they're meeting with care management, they're reviewing patients. We've educated them to have discussions with the care managers on how this remote patient monitoring could benefit the patient going home, and having the case management support our recommendation for the use of remote patient monitoring. Presenting to the board of directors of the ACO. We want everyone to be as knowledgeable as possible and to be able to have the buy-in. Primary care physicians, really, providing education to them for referrals of patients back to us. And just overall to all of our staff, keeping them abreast of what the equipment can do, the different programs, etc., and engaging them as much as possible every step of the way with the program and the implementation. So when it's time to roll out the program, they're going to feel that they've been involved, but they also feel knowledgeable on it. And as you're providing the in-service and orientation of the program, they have a great sense of it, and it's much easier for them. And lastly, it's really important to let the patient see and touch the equipment. Trust me, everyone has a different idea of what this equipment is and how it works. Some of them think it's Big Brother and there's a camera watching over them and monitoring every step of that they make. And then others totally embrace it and can't wait to use it and try it out. They get on the scale 10 times in a day, do about 15 blood pressure recordings. We do get them to, follow our set time frames, but everyone has a different reaction to it. And, we had an older set of siblings who lived together, and both of them were in and out of the hospital. And we asked them if they'd be part of our program, and they were more than willing. And we've started monitoring them. And we noticed every morning that the brother would just, for some reason, take off his armband. And that prompted our nurse, who was looking at the dashboard, to give him a call. And he'd say, just making sure you're there. And he'd chuckle. For them, it was a tremendous relief knowing that they were being monitored. And, they'd had numerous ED and hospital admissions prior for CHF. And I can proudly say they haven't had any ED visits or hospital admissions with the use of the monitoring equipment. So for us, really that, education to them, and everyone is going to act different with the equipment, but, just give them some time and they will come on board.
Really great. So I know when you're considering these remote patient monitoring services and technology are likely going to be partnering with an organization to provide this service. So, what is your advice for a healthcare organization looking for a partner for remote patient monitoring software and services?
That's a great question, Maria. When we were looking to partner with someone, we spoke with many organizations and many companies, and what we really were looking for was a true partner, someone that was highly respected in the hospital at home arena. Even though Integra itself was looking at just the remote patient monitoring, we knew that there would be growth within our health system for a hospital at home program. So we needed to have a partner that was going to be willing to work with the two separate operating units within the one health system, and both with totally different use needs. Like I said, our community hospital was looking for a hospital at home platform, and Integra was looking for a remote patient monitoring platform. And we needed a partner that was going to, allow with the integration into our EMR platforms. And I can proudly say that we are actively testing the integration into both of our platforms. The hospital at home uses Cerner, and we use Epic in the remote patient monitoring. And I know this is going to seem like a really simple feature, but this was a key and really one of the biggest ones for Integra was the ability or the capability for the phone and tablet to be able to be used by the patient, to be able to go back and forth between our patient and our provider, and to be able to have that access. And we also wanted to be able to contract to have either navigator, nursing, provider support if needed for the monitoring of after hours alerts. And Bioformus was really able to meet all of our identified needs, but more importantly, they were able to meet the needs that we didn't even know that we were going to have. Mm-hmm. They were one step ahead of us. And for Integra, the ability of our organization to have patient alerts monitored by the remote monitoring company and to contract for nursing and provider services, this was huge. And it's allowed us to grow our program. And we haven't had a worry of scheduling staff for coverage of alerts after hours while we're still recruiting, hiring, and orienting the new hires to our remote patient monitoring program. So for us, it's just been a win-win with our partnership.
That's great. So you've been talking about all the stakeholders involved when you're starting a program like this, and patients and clinicians are obviously at the top of that list. So what kind of feedback have you had from your clinical users and your patients on the remote patient monitoring program?
The clinicians, it's only positive, and actually both patient clinicians, it's totally positive all the way around. The use of the Bioformus remote patient with the product and the program, it's just been wonderful. The clinicians absolutely love having the ability to proactively manage their patients instead of reactive management. That was one piece that we've always been trying, always tried to manage, is that reactive management, but this was that tool in the toolbox that we needed. We've been able to track trends of their patients' biometrics and being able to correlate that data together and being able to bring that to the patient and show them how their behaviors has had an effect on their health. It's just huge. And for our patients, they're just thrilled that they can stay in their homes. They have a team that is aware of their vital signs, etc. They, aren't purchasing a blood pressure cuff through the pharmacy, etc., and doing it that way. They love being able to really have a provider overseeing them and overseeing their home monitoring. As one patient has said to us, I have such peace of mind knowing you're monitoring me. And we've actually had a few patients who have requested that we continue to monitor them post 30 days as they feel they have an added sense of security with the monitoring equipment in place. So, both our patients and providers absolutely love the program.
That's great. So we've covered a lot of ground on some of the great things that Integra has done to date in terms of this program. Can you talk about what's next for your team?
With Integra and really Care New England, we're looking at expanding our disease management program into the provider offices enhancing our chronic disease programs. And we've actually just started looking at RTM, which is remote therapeutic monitoring. And we'll be working to bring that forward to our patients. Bioformis has been a tremendous partner with us, and we look forward to enhancing our capabilities with them. Technology is truly at the forefront of all our future endeavors at Integra and Care New England, and we're just going to continue moving forward.
That's great. Well, that takes us to the end of our time together. Thank you so much, Ruth, for joining me today and talking about your remote patient monitoring program.
Thank you for having me.
And then I would like to once again thank the sponsor of this episode, Bioformis. For more information about Bioformis, please visit bioformis.com or email care@bioformis.com. To our audience, thanks for tuning in today. Look for more one-on-one episodes in the coming months by visiting our website and our social media platforms.